Cheryl Gambacorta is the Director of Clinical Operations for the Visiting Nursing Association of Western New York. She's here today to talk a little bit about oncology care during the pandemic and the coronavirus. Cheryl, thanks for joining us today.
You're welcome. Thank you.
So I did want to start. I know that the VNA, as well as Kaleida Health and the Great Lakes Health Cancer Care, have been working on a pretty unique oncology program over the past, say, 18 months or so. If you can, let's first start out talking about cancer care and navigation. What is the role of a cancer or an oncology navigator or nurse oncology navigator?
Well, our oncology navigators are clinicians, and they play a vital role in navigating that patient across the system to be able to access the care and reduce barriers to the care that they need. So they really look to acknowledge the fact that a patient's now become with a diagnosis of cancer. They take them through the course of care, whether it's getting to medical oncology, radiation, infusion, to the surgical team. They work multidisciplinary. So they really evaluate what is it that the patient's going to need, what are the barriers that are causing them not to get the care timely and access it, and then break down those barriers with interventions. So they're extremely resourceful clinicians who look at each and every patient individually. They look to evaluate what needs to be done to navigate that patient and take care of them across the whole continuum, and making sure that they get all the resources and all they care and break those down and really just get them through to survivorship.
So this is a case where someone is assigned to a patient who may have a diagnosis, and that patient obviously is dealing with a lot of unknown. There's a lot of fear, but there's also a lot of, I don't know what to do. I don't know where to go. So that navigator helps through that process?
They do. So when the patient doesn't know what to do, those navigators listen to that patient. What is their concern? What is their fear? What is the unknown? So they do a lot of advocating, they do a lot of educating, and then they help guide them. They work very closely with the providers, because the providers are key to what the patient needs, and then work with the navigators, and their relationship is excellent. So they do that, and then evaluate what can they do for the patient, and then help them through. So if they need nutritional services, where can they get that? Are they capable of going to outpatient? Are they getting it at the doctor's office? Or are they getting it in home care? It's also the same for therapy. If they need PT or OT, if they need medical social workers or financial counselors, that's a lot of the barriers, is getting timely initiation of their treatment, getting to radiation or to chemo. So they really do work to make sure that that patient is cared for from start to finish.
That's great to hear. A cancer diagnosis obviously is very stressful, emotional, but to have that occur or to be dealing with it in the middle of the coronavirus, it has to be even more stressful, and there's got to be a lot more fear. How are the patients dealing with the current situation? What are some of the questions that your team, what are some of the questions that the navigators are getting?
Well, the navigators have expressed the fact that this has been a very crucial time for those patients. And it has been very critical to really taking that individual, listening to their concerns, a lot of fears, a lot of unknown. The questions are, is it safe to go to the doctor? Is it safe for me to go to my radiation treatment or to go to outpatient services? The navigator really helps to answer those questions, to listen to their fears, to know, what should they be able to do during this time? Because these patients are feeling isolated. They're immunocompromised from their treatments, their status post-surgery, if that's what's been done. So they really have to, they're alone. They're very lonely. We also have mental health counseling that they put in place, for resources to help them with that also. It's the navigator really is that advocate. That is that person that really listens to all the things that are going on with that patient, to help them, to support them, and to make sure that they get what they need and to ease their concerns during this time. So,
and I would think that probably one of the biggest concerns that the patients are facing and that the navigators hear about are the safety measures that may be in place, or are they in place? So oncology offices are open. People are receiving infusion therapy. They are getting the radiation treatment. They are, going in for surgery. But there probably is a little apprehension on the patient side in terms of, geez, is it safe to go into that physician office? Is it safe to go into the doctor's office? What kind of measures are in place to ensure that they are?
Well, the navigators really take a lead on this. They have all the guidelines from the Department of Health, the CDC. They evaluate, they know the safety measures and from each office. So what they do is they really just outline it for each patient. They let them know that you're going to do a self-check before you go to an appointment. So they'll check their temperature. They'll question them if they have symptoms. Once they get there, they let them know when you approach a facility and you arrive, the office will check your temperature. You will have a mask. The staff all have masks. There's a lot of hand hygiene. There's a lot of cleaning of the rooms in between. It really is a safe place, and it really is important for them to see their oncologist or go to their treatment centers. There are options for them to stay home for certain things and to get home infusion or to get home therapy or to do things like that. And then there's also the opportunity to do video calls with the doctors, and that has taken place. And that's really eased some of the patient's concerns. Just have a video call with the office staff or with the physician, and then a follow-up at the office. But that has seemed to really help with supporting those patients and getting them through this difficult time.
Cheryl, as we wrap up, I did want to ask you as a closing question, for those who have a chance to watch the video or those who may be going through a cancer diagnosis, they may have a loved one who's dealing with this. This may be a neat topic. This may be something new to them. If someone wants to get connected with the navigator, if they just have a question, may have a few questions as to, tell me a little bit more about that. How can they reach out to the VNA? How can they learn more?
To reach out to the navigation program itself, first of all, the patients through Great Lakes Cancer are hooked with a navigator right off the bat. So as soon as they are diagnosed and they are starting to work with their physician, then they are automatically started with the navigator. They're given a folder. It has all the information about navigation. Welcome to the program. It has brochures. It has commonly asked questions on what to ask your navigator. It also will give them their business card with their name, their cell phone. The navigator will reach out and do a welcome also if they're not on site at the doctor's office for the visit, which they will do intermittently. Then what they will do is if once they're hooked with it, they know to just contact their navigator for any questions, any concerns. If they aren't linked and they haven't heard from anyone, then it's really calling on the call center through Great Lakes, and it's the 884-3000 number, and let them know that they have some questions and some concerns, and that call center will send a triage and get a navigator to contact them.
Cheryl Gambacorta is the Director of Clinical Operations for the Visiting Nursing Association of Western New York. Cheryl, thanks for joining us today. Thanks for letting us know about cancer navigation in Western New York.
Thank you, Mike.